Diabetes is a real scourge when it comes to vision. So diabetes, as we all know, causes high blood sugar levels in the blood. And the problem is those high sugar levels are damaging to small blood vessels. And that happens everywhere in the body, but particularly in the eyes, the retina itself is very, very sensitive to any kind of damage to blood flow. And so when you have that repeated damage over years and years and years, you can get areas of the retina where the blood supply is compromised, and you can get other areas where the blood vessels become damaged and leaky. And so diabetes in the back of the eye can cause little spots of bleeding that don't really impact on the vision. That's just a warning sign to us that the retina is not very happy. But then it can cause new blood vessels to start to grow on the surface of the retina, because the body tries to repair the damage by growing new blood vessels, but they grow in the wrong spot. And they grow on the surface between the gel inside the eye and the retina itself. And the problem with that is those blood vessels are very fragile. They can tear and they can bleed, which can damage the vision because the eye gets blood in the gel. Or they can pull on the retina, because as they start to try to reinforce themselves because the body knows it's a weak point, they get scar tissue forming around them, and they start to pull on the retina itself, and that can cause a form of retinal detachment because it pulls away from the wall of the eye, which requires, again, a big emergency operation. Thankfully, those kind of changes are fairly rare. That's quite severe down the end of the spectrum. But what can happen earlier is if the blood vessels around the macula, which is the site where all of your central vision is, if those blood vessels get damaged, they can start to leak, and that leaking of fluid causes swelling in the macula, which makes the central vision blurry. And so that's the most common thing that I see that needs active treatment in terms of diabetes in the eye. And that can happen quite early in the process, just by bad luck, essentially. And that's one of the things where diabetic patients need injections of medication into the eye to help seal off those leaking blood vessels and relieve the swelling to improve the vision again. And so, diabetes, can be a really difficult condition to live with. It can be difficult to keep your blood sugar under control. So, I don't want anyone feeling like there's any blame there. This is just something that can happen. You can do your best, particularly with macular edema. You can do your best to control your sugar, and you can still end up with this just as a process from the damage that diabetes does to the eye. So, it is quite a common thing that I see, but it's very treatable.